In this video, I'm going to tell you everything you need to know about derma rollers for hair growth to help you grow as much hair as possible in the shortest time possible. And definitely make sure you stay all the way to the end, because there's one tip in here that I personally discovered that makes all the difference between growing some hair with derma rollers and growing absolutely nothing. So let's have some background information about derma rolling for complete beginners. The first thing you need to know is that the term microneedling is the same as derma rolling. The two are interchangeable. It's a popular treatment for skin aging. You'll find it in most good skin clinics, but only in the last 30 years has it become used for hair loss. So let's talk about how derma rolling works for hair loss and in general. So the roller has many fine needles. The roller looks something like this. So it has lots of these tiny pinprick-like needles. Some are less than 1 millimeters in diameter, so very, very small. And the idea is that these will cause very small microscopic injuries to the skin or scalp, and that is what stimulates the hair growth, or basically reverses and improves the skin aging. And we think it does this through one, increasing collagen production. Number two, some say that it changes the way stem cells are produced, and therefore this is how it works, but nobody is 100% sure. Other people say that the way it works is by improving blood supply, but to be honest, nobody is 100% sure so far. Now, I want to ask you a question. Are you thinking of using derma rollers? Are you already using derma rollers? And if you are using derma rollers, even thinking about using them, tell me, do you have mild, moderate, or severe hair loss? In the comments below, and I'll tell you if I think you should be using derma rollers, or maybe if you should be trying something else. But let's talk about the benefits of derma rolling. The first one is good. It's been proven to provide good levels of hair growth if done right, and we'll talk about what this means in a minute. Improves absorption of hair loss treatments. So if you use it with things like minoxidil, together with derma rolling, this improves the absorption of minoxidil and gives you better hair growth. And thirdly, it's proven to improve a condition called alopecia areata, which is a condition where a person completely loses all the hair on their body and scalp. Now, let's talk about this bit here where I mentioned that it gives good hair growth if done right. So what does it mean to do it right? So the conditions for doing this right, for doing derma rolling right, especially at home, is number one, you should really see a skilled practitioner. So the person doing it for you has to be a skilled professional. They have to be using the right size and density of needles. That's also really important. So the type of derma rollers that you buy is important. And the third condition is that you need to be using other hair loss products. So for example, if you use derma rollers with minoxidil, you will get better result than somebody using just derma rolling. And finally, your hair loss needs to be mild to moderate for optimum results. So derma rolling is not really a miracle worker. It's less likely to grow hair from thin hair. So you need to have some hair left for the derma rolling to give you optimal results. How should you apply derma rolling? This is if you're doing it yourself. So the first step, which I highly recommend, is to see a practitioner first. So the first couple of times, see a good practitioner, let them show you how to use it properly, and then maybe you can take it home and do it yourself. So the first step is topical anesthetic is applied. So this is just something to numb and prevent pain. The length of treatment is generally around 10 minutes, so it's not that long, but it depends on the area. So if you have a very large area, then it can be longer than 10 minutes. And usually a topical balm, so this is like a cream, is applied after the procedure just to kind of prevent any soreness or any complications. And some practitioners also use an injection. They actually apply an injection into the scalp, which A, prevents further pain, and B, promotes better growth. That's the idea. And usually the treatment is needed once a week. This is agreed that this is the optimal frequency of treatment, that it should be once a week. So let's look at sample result. I'm not saying this is the best results out there or the worst. This is just a sample results just to compare how derma roller compares, say, with minoxidil. So this is a study that compared derma rolling with minoxidil, which is Regain, which is a very popular hair loss treatment. So the red line is the people who used just minoxidil, and the green line is the people who used just derma. And this is the mean hair count. So basically they counted the hair before and after the procedure, or before and after the treatment. So with minoxidil, you can see there's been some improvement. People got some improvement in their hair count. It's gone up from an average of 201 hairs to 218. So some improvement. But if you look at derma, the improvement is much bigger. The graph is much steeper. They've gone from 226 mean hair count to 317. So they've had much better results with derma. And you can see some of the improvements in these pictures. So these are two different clients, and the first one is you can see he had extensive mid-scalp hair loss, and afterwards it's just a massive improvement. It's almost completely resolved his hair loss, especially in this middle bit here. The second case had what I would say is more diffuse thinning, and again I think the second one has actually had better results than the first one. So both cases basically confirm what we can see in this graph here, that there's tremendous improvement when derma rollers are used for hair loss. Now what I would say is, imagine if you could actually combine both. If you could use derma roller and minoxidil, you'd have the benefit of both, which is what most people these days recommend. So the one tip that makes all the difference in terms of success or failure with derma rollers for hair growth is to see a practitioner at least for the first 2 or 3 sessions. That makes all the difference. Not only are they gonna kind of get you on the right path to actually getting some hair growth from using derma rollers, but more crucially, they're gonna show you exactly the technique, the timing, the pressure that you should apply. They're gonna coach you into using the derma rollers properly when you eventually move on to using it yourself at home. That really makes all the difference. Now let's talk about some of the possible side effects with derma rolling. Now, the key word here is possible, so I don't want anyone to read here these possible side effects and say that, oh, you'll definitely get these. These are possible. Some people get them, some people never get any of these. So the common ones are bruising, pain, swelling and redness immediately after the procedure, and these should go within 5 days usually. Now these are more common if you are doing this at home yourself, and specifically if you don't know what you're doing. If you don't know what you're doing, then you are more likely to get these issues. This is why I say you should see a practitioner for the first couple of visits, and then when you know what you're doing, do it yourself at home. And you should really speak to your healthcare provider before you use derma roller, if you have eczema or acne, if you have diabetes, or if you use blood thinners. So, I'm sorry, there's a spelling error there, should be 2 N's. So if you have any of these conditions, you should really speak to your healthcare provider first before using derma roller.